not to go down a rabbit hole of insurance companies, but when you have all these roadblocks in place, it really makes that difficult.
Because I saw actually, I don't know if you see on LinkedIn where they have like the prompts of like questions that you can answer if you're an expert within an industry. Well, I got one that asked me to answer what to do when you're trying to change the patient care approach for a physician and they're reluctant to it. And in my head, I'm thinking, the reason they're reluctant to it is because you're trying to change the patient care approach to be worse. You're pushing the numbers. You know, most of the time, a healthcare stakeholder or an insurance company is saying, you've got to see more, you've got to do more for less. And so, yeah, physicians are going to be reluctant because they're focused on the doctor-patient relationship and you're focused on asking them to essentially see more patients for less money. Like, how does that, like, of course they're going to be saying, hey, no, that's not the right way of doing this. So it's just interesting too, how like the world around us is not yet opened their eyes to see the problem is not in the physicians.
Exactly. And I don't know how that narrative started. I mean, I'm sure it started long before I started practicing. But I think more and more people are catching on to that. I mean, not to go down a rabbit hole of insurance companies, but their quarterly profits are readily available for everyone to see. So when you think about an insurance company who is making profit and at the same time they're denying healthcare for people that they've never once seen face to face or done an exam, they're just relying on a note. I think it's difficult, right? I think not only in my specialty, but any specialty where end of the day, you're just trying to help the patient out. And when you have roadblocks like this, I think it adds to everything that we hear about now about physician burnout, even just the number of patients you can see per day. You want to help as many people as you can. But when you have all these roadblocks in place, it really makes that difficult.
It does. And I think it impacts, like, I think there's a million different ways to look at it, right? I think schooling is too expensive. So then people get out of school and they need to make X amount in order to pay back their loans and also afford a life. Like, by the time physicians are out of school, they're likely in their 30s, sometimes 40s, sometimes later. And in that case, it's like they probably have children. They have a mortgage. They have school loans now to pay back. And also, by the way, like, you're in hot demand and you've got to work crazy hours and figure out work-life balance. Like, there's a reason why depression is so high in physicians and why there's so much burnout. And I think, like you said, like, I really hope that something happens, because at the rate we're going, it's not going to work. It won't be sustainable. And we're already seeing such a huge gap in physician shortages that I don't know what the insurance companies think is just going to magically happen. I feel like everyone's just going to fall in line and continue on with this circus. But I see it every day in recruiting that people are moving out of healthcare. They're moving into leadership because they're like, if I can't fight it, I'm just going to go try to be on that side of the table.
Mm-hmm, exactly. And I think too is, I feel like growing up, people would always say, oh, be a doctor, you can have a good life. And don't get me wrong. I mean, I love being a physician. If I had to choose it again, I would 100%. But if you're going into medicine to make money or the prestige or whatever, all these external reasons, you're going to be really disappointed because there's a lot of other ways to make money that don't require 10 plus years of training and multiple 60, 70, 80 hour work weeks. It's just, that's the most inefficient way to do that if that's your goal. So I think now, especially like you're saying, I mean, I read an article on Medscape the other day about the anticipated physician shortage. And unless different things get fixed, it's going to be really tough because these are the people that are going to be taking care of our family members, our parents, our grandparents. And then when it's our turn to receive that consistent medical care, we want people there that are there for the right reasons and that are knowledgeable too. So it is going to be interesting to see how this healthcare landscape changes as the future goes on.